Imagine spending years of dreaming of becoming a doctor, clearing needs, surviving the toughest entrance exams, and finally getting admission into a brand new medical college, the kind of government proudly inaugurates every year. But what if when you reach there you realize there is no patients to learn from, no proper teachers, no labs, no mental health support? You're not being trained to save lives, you're being trained to survive the system. This isn't fiction, this is the shocking reality revealed by the nationwide survey conducted by the Federation of All India Medical Association or FAIMA. And what they found exposes a deep painful truth about India's rapidly expanding medical education system. Let's start with what the survey uncovered and why every medical student and policymaker should be alarmed. The FAIMA Review Medical System Survey is a massive exercise covering 28 states and union territories. It collected over 2,000 responses from medical students, teachers and professors, both in government and private institutions. But here's the important detail, 90.4% of the responses came from government colleges, which means this isn't about a few bad private institutions. This is a mirror reflecting India's public medical education system itself. And what this mirror shows isn't pretty. India has opened dozens of new medical colleges in the last decade to increase the number of doctors, but the FAIMA survey reveals that quantity has overtaken quality. Only 71.5% of respondents said they had adequate patient exposure, meaning nearly 3 out of 10 students don't even see enough patients to learn properly. Just 54.3% said teaching sessions happen regularly. Even labs and equipment facilities, the backbone of any medical college, were only considered satisfactory by 69.2%. So yes, buildings exist, but the learning ecosystem is barely functional. And when you look at who's supposed to teach the students, the picture gets even worse. The survey found faculty adequacy is just 68.8%. That means nearly one-third of the colleges don't have enough teachers. Professors are stressed thin, forced to handle teaching, patient care and administrative work. The result, students don't get mentorship, teachers don't get rest and learning suffers across the board. But even if you manage somehow to learn, you'll soon face another roadblock, the lack of practical training. Modern medical training depends on skill labs, places where students practice real-life scenarios before handling patients. Yet FAIMA found that only 44.1% of respondents had access to functional skill laboratories. In other words, more than half of India's medical students are being treated without simulation or practical tools. So how are these future doctors supposed to perform in emergency rooms or operating theaters? The short answer, they're not being prepared at all. And as if this academic chaos wasn't enough, let's talk about the financial and emotional strain these students face. Imagine working day and night in a hospital, barely sleeping, only to realize your stipend hasn't been paid for months. That's the reality for half of all respondents who said timely stipend payments are not guaranteed. Only 29.5% said they had fixed working hours. A shocking 73.9% reported being overburdened with work, not medical duties, and 55.2% cited staff shortages. And the most heartbreaking number of all, 40.8% described their work environment as toxic. You might think, hasn't the government done anything about this? Well, they did try, but only on paper. In the last few years, India has focused heavily on expanding the number of medical colleges. While the intention was good to fix the doctor shortages, the execution has been reckless. Many new colleges were opened without adequate infrastructure, experienced faculty, or hospital tie-ups for clinical exposure. This expansion may look good on election posters, but inside those college walls, the foundation of India's healthcare system is crumbling. And the ones paying the price, the students, are future doctors. India doesn't need more doctors, it needs better doctors. That means focusing not just on quantity but quality. Here's what needs to happen. Strict environment for National Task Force guidelines, transparent audits for infrastructure and faculty before college approvals, mandatory functional skill labs in every medical institute, mental health counselors and support systems for students, and most importantly, fixed working hours and timely stipends. If India wants a strong healthcare future, it must start by taking care of its doctors today